Thank you, Honorable Speaker. I think the Honorable Cabinet Secretary has been very clear on SHA and the other one. And I think the Honorable
Which is the other one?
The Honorable Wanjala needs to be awake and listen to SHIF or SHA, the one that pays and the one that you don't pay. Those are two different things. So I think Honorable is probably to say SHIF does this and SHA does this, so that the Honorable Wanjala understands clearly.
Naisula. Order. You are not qualified to answer. Naisula.
Wanjala, you're a noisemaker. Honorable Speaker, I had the Cabinet Secretary clearly giving credit to the governor of Nairobi, but then he said there are some counties which are co-charging. It is in the same breath that those counties should be named in this house, because for the same stick you give credit, we need to punish, and those counties have to be ashamed and they have to be named, and those governors should be surcharged and should be jailed for co-charging the patients, Mr. Speaker. They need to be named.
Yes, Jalango.
Thank you so much, Mr. Speaker, and thank you so much, Cabinet Secretary. The one thing that does not come out very well is to what level is SHA or SHIF taken care of. We have situations, and I had a public participation just the other day, where we have patients who SHA have covered large amounts, and those that have been covered in very small amounts. So they keep on wondering. This guy was paid, the patient was paid, bill was paid to an extent of 300,000. There's this one who is requesting only 15,000. It is not being paid. So there's one thing that the Cabinet Secretary and his team must come out and tell the public. Continuous communication about what is covered by what to what extent. And lastly, Mr. Speaker, during this public participation that we had with our people, there are those who still want even to be told to be taken through on how to register, and they want to register, they still don't know how. And your medium of communication cannot rely on TV and newspapers only. Nowadays we have so much. You're even talking about AI being used now in the medical space. We have these influencers. We have these social media spaces that we need to have this communication go out again and again so that we demystify this thing about SHA. It is working, yes, but you get to a point where you have to still have to explain to people, Mr. Speaker. Cabinet
Speaker, the Cabinet Secretary needs to come out, as my colleagues have said, very clear on what SHA covers and what SHA does not cover. And I want to go on record, Honorable Speaker, my own mother stayed in hospital for 5 days, and SHA, out of her bill 213,272, SHA only paid 11,740. Honorable Speaker, Cabinet Secretary, what's not happening? Surely something is not being truthful. We are not telling the Kenyans the truth on what SHA can and what SHA cannot do. NHI probably used to pay better than this. We just need that comfort. Communicate very clearly, and evidence is here. Hospital bill is here.
Kibagandi.
Thank you, Honorable Speaker. First, I would like to be very clear that the CS is talking about an ideal situation. That is not what is happening on the ground. Just like Honorable Oundo, my mom has been sick for close to 10 years now. In 2019, she was operated on. It is called diabetic foot. And the bill then came to about 625,000. NHIF paid 270 or thereabout. On Saturday, the bill for my mom, who has been ailing again and had to undergo 2 operations at Metropolitan Hospital in Buruburu because of diabetes, the bill came to 1.1 million shillings, and the bill that was paid by SHA is 123,000 shillings. I shared that with my chairman, and we shared that with the hospital. And Honorable Speaker, today I'm trying to control myself so that I don't demonstrate the unfortunate thing that happened the other day. What I would like to assure you, Honorable Speaker, is that nobody in this country has done research on SHA like I have. Number one, on issues to do with benefits. The benefits in SHA are inferior to what NHIF was offering. That is one. Number two, the processes of reimbursing hospitals is systematically oppressive to hospitals, in the sense that hospitals now are too careful on how they handle patients. Number three, professionalism within the ministry, SHA, and every other space within the Ministry of Health, Honorable Speaker, we have trouble. And this is happening, including up to the counties. And at this point, Honorable Speaker, I would like to request the Honorable Cabinet Secretary, when people raise concerns, please don't politicize these concerns. Seek to have proper interventions for these concerns. Thank you, Honorable Speaker.
Thank you, Mr. Speaker. I want the Minister to confirm two questions. Number one is during means testing that those Kenyans who are perceived to have some stable source of income will pay more than those who do not have, so that we can be able to understand why Kibagendi's mother, NHIF, paid more than what SHA is paying her. If that clarification is done, then we can understand that in terms of means testing, the amount you pay is dependent on your perceived income. Number two, can the Minister confirm to this House, because any new policy that the government implements must either generate into some small public problems, because it is new. You may think you are solving one, then 3 or 4 comes up. So can the Minister confirm to this House that in his ministry, he has set up a team that will entail in collecting data, collecting those problems that are coming in implementing this SHA and SHIF, and that they are working around the clock to ensure that those problems don't recur again, because policy improvements are done by using feedback as a tool for continuous improvement. Can the Minister confirm to this House that indeed Kenyans should be confident that SHA and SHIF will continue to improve because they are collecting data which they use as a tool for continuous improvement? I thank you, Chair. Yes.
Thank you, Mr. Speaker. Mine is just to ask the CS whether the ministry has ever done what I'll say, just go and do your tour to different hospitals, sample out, and get to learn what is the biggest challenge